A number of researchers have hypothesized about the potential biological explanations for gender pain differences, but I'm not going to go into those in my talk. Rather, I want to focus on the fact that pain is a product not only of biological factors, but also psychological and sociocultural factors. To date, most of the attention has been paid to the biological side, and I think there is a great need for greater research about the impact of these other factors on gender difference in the experience and reporting of pain. But some of the findings from the few studies that have been done in these other areas include the following. As regards psychosocial factors, women describe pain within the context of how it affects their personal relationships and ability to take care of their family responsibilities. Men, in contrast, consider pain in terms of how it may threaten to interfere with their work duties. They tend to focus on how pain will affect their functional abilities rather than their personal relationships. Men and women also have been found to cope differently with their pain. Women cope by expressing their feelings, seeking social support. Women have a greater tendency to engage in interpersonal or communal approaches to coping. Women also look for ways to take their mind off their pain and are more likely than men to consult a healthcare provider. One interesting study, for example, found that in a laboratory setting, males report less pain in front of a female researcher than a male researcher, whereas the subject's or the researcher's gender did not affect the response of female subjects. In addition to whether the patient is a man or a woman, physical attractiveness and nonverbal expressions of pain have been found to influence a healthcare provider's response to a patient's pain. Hadjis Stavropoulos and colleagues found that physically unattractive patients were more likely to be perceived as experiencing greater pain than more attractive patients. And the more attractive patients were more likely to be viewed as able to cope with their pain. These differences in perception were more likely to be true for female patients than male patients. That is, attractive female patients were thought to be experiencing less pain than unattractive female patients. Next, the authors concluded that a strong, beautiful is healthy stereotype was used by healthcare providers in assessing patient pain, and that attractive persons were perceived to be experiencing less pain intensity and unpleasantness, less anxiety, and less disability than physically unattractive persons. Next, what accounts for these differences in treatment is more a matter of conjecture than any conclusive or definitive data. Some have speculated that it's a result of a belief that, next, women have higher natural capacity to endure pain than men. Some attribute that to their biological role in childbirth. And next, women have better coping mechanisms for dealing with pain. The literature I mentioned earlier, in fact, confirms that women have a greater repertoire of coping skills to deal with their pain than do males. Next, others speculate that less credibility is given to women's reports of pain. Healthcare providers must rely on patients' reports of the pain because there's no objective test for pain. You can't take a blood test or urine test or any other kind of test. You have to believe the patient. The literature indicates that healthcare providers tend to discount women's reports of pain as emotional or psychogenic in origin and therefore not real. Now, I'm often asked when I give a talk on this subject whether it makes a difference whether your doctor is a man or a woman. A recent study on how healthcare providers respond to facial expressions of pain found that women physicians significantly outperformed men when it came to sensitivity to pain expression. They were able to better detect the presence of pain expression than men. And the authors attributed this to research finding that females are generally better than men at decoding nonverbal cues. Given that differences in treatment do not appear to be based on any biological differences in pain experience, in fact, from the literature, you might expect that women would be treated more aggressively for their pain than men. Next, so one might conclude through a justice or a bioethics lens that this is an unjust response. Both men and women need to be treated adequately for their